Mr Wilson, and it's a real pleasure to serve under your chairmanship this afternoon. I would like to congratulate the member for Hales Owen and Rowley Regis in securing this vital debate on the final report of the Independent Taskforce on Mental Health and for his excellent contribution. I'm very pleased that we have the opportunity today to examine this incredibly important piece of work and also to hear from the government in terms of their response in detail. If I can thank all those members who have spoken in today's debate, the quality of speeches we have heard, I think, are a testament to the strength of feeling on all sides of this House on the issue of mental health. I echo the contributions that we've heard today when I say that the Task Force report is an extremely comprehensive piece of work, and I would also like to take this opportunity to pay tribute to all of those who are involved in delivering it. The recommendations it makes are robust and wide-reaching and signal what the chair of the task force, Paul Farmer, CBE from Mind, has rightly described as a landmark moment in mental health. And if I can also mention Vice Chair Jackie Dyer and thank her for her commitment and passion. If implemented in full, these changes could really make a huge difference to a system which is under increasing and unsustainable pressure. The real challenge that now lies before us is ensuring that the aspirations set out in the report are actually delivered. For too long, the rhetoric on mental health has not matched the reality on the ground. And I know that members here today have reflected the concerns felt by those people across the country that we all represent, the people who themselves suffer from mental health conditions, their families, and the services and professionals that care for them, who are anxious to ensure that the opportunity we now have to transform mental health in our country is not wasted. I also will focus my remarks today on implementation and three key areas where there remain some unanswered questions, and they are namely funding, transparency and accountability. Firstly, the money. The task force identified a £1.2 billion funding gap in mental health services each year by 2020. The government responded to the publication of the report with an announcement of an additional £1 billion worth of investment for mental health services up to 2020, which of course is very welcome, Mr Wilson, but I understand that this £1 billion will be taken from the £8 billion set aside for the NHS up to 2020. And if that is the case, and perhaps the Minister can confirm for us today, I struggle to see how this will meet what the task force says is required. Given that mental health already receives just under 10% of the total NHS budget, it is difficult to see how the funding announced could be considered as additional, particularly in the context of the £600 million cut that mental health trusts have experienced over the last Parliament. And I would have thought that the Minister would have allocated that proportion of the £8 billion anyway to mental health, and so I would be really keen to hear his response on that very particular point. There are also some very real concerns about how this funding will be distributed and what systems will be in place to ensure that it reaches the frontline services for whom it is intended and not siphoned off to plug the deficits for acute trusts. And that's a point that's already been made this afternoon by the Right Honourable Member for North Norfolk and the Honourable Member for Bexhill and Battle. The Minister is right to prescribe that CCGs must increase the amount of their budget that they allocate to mental health at a rate at least in line with the general growth in their budget. But as this budget information is not published centrally, I'm yet to see any evidence from the government that they are able to guarantee that CCGs are fulfilling this commitment. And in fact, I've had to carry out freedom of information requests which have shown and exposed the fact that more than 1 in 3 CCGs are not meeting this expectation. The Health Secretary announced just before Christmas that from June there will be independently assured off-style ratings for mental health provision by CCG area that will expose the areas that are not making the commitment to mental health that they should be. And I asked then if he would clarify whether this commitment would include publishing a clear picture of mental health spending for every CCG. And I'm still awaiting a response to the follow-up letter I wrote to seek clarification on this very important point. And I'd be pleased if the Minister would be able to confirm this for us today. He will know that we on this side of the House strongly believe that the annual survey of investment in mental health must be reinstated. It was stopped in 2011. It's an absolutely crucial piece of information. It's especially important given the concerns that have been raised by many honourable members today, but also by the Mental Health Network, which represents mental health trusts, who have said that providers of mental health services are yet to see the difference from the investment in child and adolescent mental health services that the government announced last year. And many honourable members during the course of this debate have raised very specific concerns about child and adolescent mental health services and the imbalance in the amount of allocation of the overall mental health budget that they receive. It's less than 10%, and it's a very significant challenge. And I'd be interested to hear the Minister's response to these very serious concerns and his response to the proposal from many mental health leaders that this cash should be ring-fenced. And again, I'd be very keen to hear what he thinks about that. This brings me to the second key theme of the report, and that's a startling lack of transparency and accountability in our mental health system, mentioned already by the honourable members for York Central and Gillingham and Rainham. The significant gaps in the information that the government collects on mental health presents a significant obstacle in their ability to deliver what they have promised on mental health. We saw further shocking evidence of this information gap during Monday's BBC Panorama programme, which highlighted the discrepancy between the data the government holds and the number of children who have died in inpatient mental health trusts and units, and figures from the charity Inquest research. And I raised it in the House yesterday. I give way.
I'm very grateful, and I totally agree with the point that she's making, and I always took the view that I was operating in a fog without access to the proper data. And in the Panorama programme, it made reference to the fact that I gave a parliamentary answer saying that there had been no deaths in children's mental health services, an answer that was wrong because I was given the wrong information. And I have asked the Secretary of State for a full investigation into how that happened. We have to have absolutely accurate reporting of these things.
Sienna Berger.
For his intervention, I believe it's absolutely imperative that we are able to see how deaths in psychiatric care are not only treated and recorded, but also investigated and learned from. And we've heard from the Minister there'll be some progress on that front. It's particularly concerning given the ongoing case of Southern Health NHS Foundation Trust, which was found to have failed to investigate more than 1,000 unexpected deaths of mental health and learning disability patients since 2011. And only last week, more than 2 years since the very tragic death of Connor Sparrowhawk, Southern Health Trust was found by the Care Quality Commission not to have addressed serious concerns raised about the safety of its patients and was issued with a warning notice. And I'd be really grateful if the Minister would share with us what the government is doing specifically to improve the mental health data that is being collected and published and made accessible to the public, and when we will have a very further update specifically on avoidable deaths in mental health and in learning disability. Data, Mr Wilson, is absolutely critical, not only if the government are able to understand the realities of what is happening on the ground, but also if we are able to check if the government is delivering on what they've promised, which brings me to the final point I wish to cover today, and that's accountability for the implementation of the task force recommendation. The task force asked that NHS England, the Department of Health and the Cabinet Office should announce what governance methods they intend to introduce for the delivery of the recommendations. And this really is needed as a matter of urgency. We need greater transparency than before in the way the recommendations are implemented. And I note that one of the recommendations of the task force report is that the government accepts the recommendations from the previous task force on CAMS, and again, an issue raised by many members during today's debate. A reflection, I believe, of the fact that delivery of these recommendations has been too slow. And I'd be grateful if the Minister could confirm what plans there are to publish and publicise updates on implementation of the task force's recommendations. The Centre for Mental Health has produced a fantastic report for NHS England, which explores what helps and what hinders the implementations of policies and strategies relating to mental health. I don't know if the Minister's had a chance to read this report, but amongst other things, it calls for a robust implementation infrastructure to support local agencies in delivering the report's recommendations. And I'd be grateful if the Minister could share with us today what plans there are to support local authorities, CCGs and mental health trusts to really deliver on this strategy. Many of the recommendations in the task force report also require government departments to deliver their own areas of work that relate to mental health. For example, from the Ministry of Justice, the Department of Work and Pensions, and the Department for Education. I was very pleased to see these recommendations, and as I've said and I will continue to say, we will not address the challenges of our nation's mental health from the Department of Health. Prevention and early intervention is absolutely key and crucial, a point made by my honourable friend for Coventry North East. Take, for example, the work of the Ministry for Justice. The report calls for the completion of the rollout of liaison and diversion services, as well as increased uptake of mental health treatment requirements and improvements to prison mental health care. It's absolutely crucial at a time in a country where we are seeing one death every 4 days in our prison, one person taking their life. Absolutely crucial that we address this very serious issue. Again, another point made by the task force is around housing and the local housing allowance, something which the government seriously needs to address. Other members during the debate today have talked about the importance of employment and actually what more needs to be doing to support employers to help people with mental health conditions into the workforce and also to support people that might be experiencing those issues. It was disappointing that the government have only formally accepted the recommendations from the task force that relate to the Department of Health and its arm's length bodies, and I would hope the Minister might be able to confirm today whether the other departments will be accepting and implementing those other recommendations. In conclusion, Mr Wilson, for many thousands of people who could benefit from these changes and the others set out in the task force final report, ministers must keep their promises and deliver the vital reforms that are long overdue and desperately needed. We've heard lots of rhetoric and warm words on mental health. Now is the time to see real action, to translate parity of esteem into reality, and I look forward to the Minister's reply.